CBS News New York is committed to breaking the stigma surrounding mental health, and we love to highlight other organizations doing the same. SOMOS Community Care here in the city is dedicated to serving New York's most vulnerable, including seniors and the minority population. And now they're one of the few Spanish language providers in the country training their workers in mental health first aid. And here to explain is Riquelmy Lamour. She is the Director of Behavioral Health at SOMOS Community Care. Welcome.
Hi, thank you for having me.
No, we're so excited. Tell us a bit more about your organization.
So SOMOS literally means we are in Spanish, and we are the people that bring care to our communities. SOMOS is a network of over 2,500 community-based healthcare providers, serving primarily immigrant, Latino, Black, and Asian communities across New York City. It was founded over 10 years ago by Dr. Ramon Talaj. And their mission is really to provide holistic, person-centered care that focuses on a person's physical, mental, and social well-being. SOMOS Community Care now is also a designated social care network, which means that they not only address medical conditions, but also the underlying factors contributing to disparities in healthcare in those vulnerable communities.
Well, let's talk about that when it comes to mental health struggles and the unique challenges of these communities that you're serving, you know, immigrant and communities of color. So what are some of the challenges they face?
For our immigrant, Latino, and Black communities, there are unique challenges because they have particular stressors that are attributed to them. For example, immigrants face the stress of acculturation, right? Learning a new language, the stress of migration itself, the trauma that comes with that, the dangers and risks that they take just by coming here physically. And then the fear of deportation, of asking for help and being labeled as unstable and not being able to receive aid here, or fear that they are not going to be able to become a citizen because of it.
Wow. Tell me about mental health first aid.
Mental health first aid is an amazing evidence-based program that was developed in Australia and then adopted here in the US. It's a training program that anyone can take, and the beauty is that you don't have to be a clinician. You don't have to have a degree in mental health. And it trains you on recognizing signs and symptoms of a mental condition and then how to address that in the immediate moment and provide support. So the same way that with physical first aid, you can clean a cut and bandage it or provide CPR until paramedics get there, with mental health first aid, you are the first line of defense. So you are the person that is recognizing what a mental health condition looks like and then providing support and resources for that person until they can see a therapist or go to a clinic or go to a support group.
Everyone needs that training.
Yes.
Everyone. So what other services does your organization offer?
So SOMOS offers a wide range of services to primary care, women's health, pediatric care, geriatric care, and of course preventive care. And with preventive care, there's a focus on social services. So things like food insecurity or housing instability, really addressing social care needs and social determinants of health so that we can improve quality of life and promote well-being.
Thank you so much. I mean, you really cover everybody, you know, from, like you said, pediatric to senior, and really the communities that need it most. So thank you for all the hard work you do. Really appreciate it.
Thank you for having us.